everyone, this is Rizzy Kabatbat and I'll be discussing the three common skin infections. So first, let us know what is skin infections. A skin infection is a condition in which germs, bacteria, viruses, or fungi infect your skin and sometimes the deep tissues underneath it. In some cases, it's caused by a parasite invading your skin. So what is the cause of a skin infection? Infections usually come from one of three main causes: the bacteria, viruses, and fungi. Yeast and parasites can cause them too. Many of these are harmless on the surface of your skin, and bacteria in particular are plentiful on all human skin. But when they enter a break in the skin, trouble can start. So there are three common skin infections. First is the cellulitis, impetigo, and folliculitis are the common or are the most common bacterial skin infections seen by the family physician. Cellulitis. Cellulitis is a common infection of the skin and the soft tissues underneath. It happens when bacteria enters a break in the skin and spread. The result is infection, which may cause swelling, redness, pain, or warmth. You're at risk if you have trauma to the skin, diabetes, circulatory problems such as not enough blood flow to your arm and legs, poor drainage of your veins or lymphatic system, or varicose veins, twisted, enlarged veins near the surface of the skin, liver disease like chronic hepatitis or cirrhosis, skin disorders such as schema, psoriasis, or infection disease that cause sore like chickenpox. Here's the symptoms of cellulitis. Cellulitis can appear on almost any part of the body. It usually shows up on damaged skin such as inflamed ones, dirty cuts, and areas with poor circulation. It needs to be treated by doctor. The common symptoms include redness, red streak, swelling, warm, pain or tenderness, leaking of yellow, clear fluid or pus. Go to the emergency room if you have any symptom with this. Also high fever or chills, nausea and vomiting, enlarging or hardening of reddened area, increased pain, numbness when you touch the area, other medical problems that may be affected by even minor infection. So here's the causes and treatment of cellulitis. Things that cause cellulitis include injuries that tear the skin, infection, infections after surgery, long-term skin conditions such as schema or psoriasis, foreign object in the skin, bone infections underneath the skin. An example is a long-standing open one that is deep enough to expose the bone to bacteria. Cellulitis treatment. To care for cellulitis, you should rest the area, elevate the area to ease swelling and discomfort. Use over the counter pain relievers like acetaminophen or ibuprofen to ease the pain as well as keep your fever down. Impetigo. Impetigo is most commonly seen in children aged 2 to 5 years and is classified as bullous or non-bullous. The non-bullous type predominates and presents with an erosion or sore, cluster or erosion, or small vesicles of or pustules that have an adherent or oozing. Honey yellow crust. His predilection for the very young can be remembered by the common lay misnomer Infantigo, or called Infantigo. Impetigo usually appears in areas where there is break in the skin, such as wound, herpes simplex infection, or maceration associated with angular chaitis, but staphylococcus or yeast can directly invade the skin and cause a de novo infection. Here is the symptoms of impetigo. It includes one or more pus-filled blister that burst easily, causing red, raw skin. Itchy blister containing fluid, yellow or tan, that seeps out and form a crust. A rash that spreads. Skin lesions or wounds on the lips, nose, ears, arms, and legs. The lesions can spread to the other parts of the body. Swollen lymph nodes near the infected area. If you or your child has impetigo caused by staph bacteria, you may notice reddish skin or surrounding red blister, full of liquid or pus that eventually looks cloudy. Blister, the burrs easily leak. Raw shiny areas that scab over with yellow or brown crust. The causes. The main cause of impetigo is a bacterial infection. Of course, the bacteria usually enters the skin through a cut, scrape, rash, or insect bite. Most of the time, the cause is the Staphylococcus aureus or staph bacteria. Sometimes group A Streptococcus bacteria can cause it. This type of bacteria also leads to strep throat and fever. Certain strains of strep bacteria that cause impetigo can also cause glomerulonephritis. This inflammatory kidney disease can produce high blood pressure and blood in the urine. Of course, the treatment. Antibiotic can treat impetigo. A provider may be prescribed topical antibiotics to put on the skin. Your child may need to take oral antibiotic, a liquid or pill, if the condition covers a large area of skin or multiple body parts. Example of antibiotic treatment include topical mupirocin ointment, or antibiotics such as cephalosporins or clindamycin and sulfametosazole. The next is the folliculitis. Hair follicles can become inflamed by physical injury, chemical irritation, or infection that leads to folliculitis. Classification is by the depth of involvement of the hair follicle. The most common form is superficial folliculitis that manifests as tender or painless pustule that heals without scaring. The hair shaft will frequently be seen in the center of the pustule. Multiple or single lesion can appear on any skin-bearing hair including the head, neck, trunk, buttocks, and extremities. Associated systematic symptoms or fever rarely exist. The symptoms of folliculitis and sign is cluster of small red bumps or white-headed pimples that develop around hair follicles. Pus-filled blister that break open and cross over. Itchy or burning skin, painful or tender skin, a large swollen bump or mass. Causes of folliculitis is most often caused by an infection of hair follicles with Staphylococcus aureus or staph bacteria. Folliculitis may also be caused by viruses, fungi, and even an inflammation from ingrown hairs. Follicles are densest on your scalp, and they occur everywhere on your body except your palms, soles, lips, and mucous membrane. Here is the treatment of folliculitis. Folliculitis is inflammation of the hair follicles. That the best treatment for follicles include washing the area and applying aloe vera gel. Diluted hydrogen peroxide, or anti-itch agents. Antibacterial over-the-counter medication containing benzoyl peroxide are often used to treat folliculitis, but resistant cases may need antibiotic pills to clear the skin. Good skin hygiene and proper shaving technique have been shown to prevent folliculitis. And that's it for the video. Thank you.